Hey guys, welcome back to my channel. So today I'm going to give you the Pharmacology 2 question and answers as per RGUHS Question Bank. So I'm going to start with the 10 marks long essay. So total there will be 15 10 marks question answers for Pharmacology 2. So one by one we are going to solve all these question and answers. So the first question will be, explain the pharmacological action, adverse reaction and the clinical uses of digitalis. So the pharmacological action involves CVS, that is cardiac glycoside digitalis, increases the strength and the speed of the myocardial contraction, due to which the cardiac output is increased. So in normal, the small doses of digitalis do not produce any significant change in the cardiac output, as well as the digitalis increases the oxygen consumption of the heart to normal. Even the second, the energy digitalis do not increases the energy production by the cardiac muscle. It increases the energy utilization, where there will be a conversion of chemical energy into the mechanical energy. So it is because these are useful for the effect of the digitalis, which is also known as cardiotonic or a cardiac tonic. So the number third pharmacological action will be blood pressure. This is the most important, blood pressure. The effect of digitalis depend upon the initial states for the blood circulation, and as well as if the blood pressure is low, it is raised to normal. The normal BP is not raised, then there will be no hypertension, as normal BP is not raised. So the fourth one, that is cardiac size. What about the cardiac size? In normal heart, digitalis decreases the size of the heart, due to which the cardiac output will be decreased. So digitalis in cardiac failure and a normal heart, it decreases. And diuresis, where the major effect of the digitalis is edema. In diuresis, due to decrease in the venous pressure, which passes the edema fluid into the blood circulation, which causes the diuresis, and also it inhibits the reabsorption of the sodium. And coronary circulation, it improves due to increased in the cardiac output and prolonged diastole, during which the cardiac coronaries get filled better. And number 7, that is effect for the blood clotting, where the digitalis in therapeutic doses do not affect the clotting time of the blood. And electrophysiological effect, these effects are a result in both direct and autonomic effect for the digitalis, where the cardiac glycoside depresses the AV node conduction, where an increased in the AV nodal refractive period. And the digitalis is also produced by the ECG, with changes like the T wave inversion change, P wave increases, and PR interval should be shortened, QT interval and ST segment will be depressed. And the extra cardiac actions will be kidney, CNS, and as well as the skin rashes, which occurs occasionally, where the adverse reaction for the digitalis is cardiac toxicity, where digitalis produces the cardiac arrhythmitis, means irregular heartbeat due to the disturbance of impulsive formation or impulsive conduction, or the both. The disorder of impulsive formation is due to the ectopic paymaker activity. And number 2, that is hypokalemia, because of loss of potassium ions, which increases the digitalis toxicity. And number 3, that will be ECG changes. So the cardiac glycosides causes shortening of QT interval, inversion of T wave, and lengthening of PR intervals. And the toxic effect on the eye, which will be in the blood vision may be disturbed, and the color of the defects will be irregular, or the vision of appearance may be occur, or the dancing dots will appear in front of the eyes. And neurological toxicity, it produces the drowsiness and headache, fatigue, and vertigo, in where the blood coagulation effect will produce the thromboembolic complication, as it increases the coagulability of the blood. And the GIT toxicity, where it produces the nausea, vomiting, and diarrhea in the rare cases. So the clinical uses for digitalis, it is used in the congestive heart failure, used to treat the atrial fibrillation and atrial flutter, where the digitalis controls the ventricular rate by depressing the AV conduction. So the second question, 10 marks, classify the non-steroidal anti-inflammatory drugs, discuss the mechanism of action and adverse effect of aspirin. So the classification of NSAIDs, that is non-steroidal anti-inflammatory drug. Number 1, anti-inflammatory action, and number 2, that is preferential COX 2, preferential inhibitor COX 2, selective inhibitor COX 2, and lastly salicylates. So in that, the paracetamol, metazomol, and nifopam are the drugs which are used under the anti-inflammatory action, whereas in preferential COX, pneumosalide, meloxicam, nambutane are the drugs which is used in the preferential inhibitor COX 2, where the selective inhibitor COX 2 will be celecoxib and etherocoxib and paracoxib. These are the drugs, and in lastly the salicylates will be aspirin, ibuprofen. These are the painkillers which used in the anti-inflammatory drugs. So even ketoprofen, diclofenac, acetophenac, eclofenac, and ketorolac. So these are the medicines or the drugs which are under the salicylates. And the aspirin is a odorless, colorless, white crystalline powder which slightly acidic in the taste, and it is soluble in water, whereas aspirin is used in the treatment of acute and as well as chronic rheumatoid arthritis. So the aspirin should not be administered in the combination with the anticoagulants drugs, and it maybe increases the risk of hemorrhage. Aspirin increases the toxicity of methotrexate, which reduces the uronic and action. Where the mechanism of action for the aspirin decreases the platelets aggregation, and it blocks the pain impulses in the central nervous system, and the antipyretic action will result by vasodilation of peripheral vessels, and it inhibits the prostaglandin synthesis. Whereas the adverse effect for aspirin is abdominal pain, cramping, or burning in the stomach, where black and tertiary stools, change in the consciousness, convulsions, severe or continuing, decreased the frequency or the amount of the urine, difficult in breathing, drowsiness, and fast breathing. So the third question of 10 marks will be, discuss the principle of bioassay, explain the bioassay of insulin. So the basic principle for the bioassay is to compare the test substance with the international standard preparation of the same, and to find out how much the test substance is required to produce the same biological effect as produced by the standard. So in India, The standard drugs are maintained by the government institutions like Central Drug Research Institute, which is in Lucknow, and the Central Drug Laboratory, which is in Calcutta. So the bioassay of insulin, where the standard preparation and its units will be minimized by the Ministry of Health, Government of India, and is equivalent to the international unit, where 1 unit contains 0.04082 microgram, and it is pure and dry in crystalline form, where the crystalline insulin. So the preparation for the standard solution, 20 units of the insulin, which is weighed and dissolved in the normal saline, where the insulin solution is acidified with HCl. The pH will be 2.5 and adds the 0.5% of phenol as a preservative. Then mix with 1%, 1.4% and 1.8% of glycerin. So the final volume will be contain the 20 units per ml. The solution is stored in a cool and uses it with 6 months. So you can use this solution up to 6 months. And the preparation of the sample solution will be, the solution of the test sample is prepared in the same way as the standard solution is described above. There are mainly 2 types of animals where are used by the insulin bioassay. The model is based on the insulin bioassay, that is mouse method, or number second rabbit method, rat epidemiology fat pad method, and rat diaphragm method, and lastly that is radio immune assay. So the first one is mouse method, preparation of standard solution and as well as preparation for the test solution. These are the similar, where the experimental procedure will be given above. Weigh 100 mice between 18 to 22 grams of the same strain which are used. The constant diet should be maintained for the animals, and there will be a fast for 18 hours for the experiment, where the mice will be divided in the 4 groups which contains 25 mice, and the insulin is injected by subcutaneous, and which incubates the mic with the help of an air incubator at the 33 degrees Celsius and absorbed for 1.5 hour, and the air incubator with a glass front provided with the 6 shelves which is used, and the temperature is thermostatically controlled, where 2 mice are kept in each of the boxes made up of the perforated sheets of metal, where the mice which die are taken out of the incubator and observe what was the feature upright which is conceived to be the mouse, and it should be well considered as convulsion, and the convulsion mice may be saved by injecting a 0.5 ml of 5% dextrose solution. So the percentage of the convulsion produces the test sample are compared with those of the standard samples, then those animals will survive may be used again for the another experiment for after an interval of 1 week. So the fourth question of 10 marks. What are cardiac glycosides? Discuss the pharmacology of digoxin. So cardiac glycosides are, or the digoxin is obtained from the leaf of the Digitalis purpura, from the leaves of Digitalis lanata, where the chemistry for the glycoside consists of an aglycon which is attached to the sugars, and the aglycon consists of a steroid ring with an unsaturated lacton ring and attached to it. So the aglycon has pharmacodynamic activity, where then the pharmacology of digoxin. So it occurs as a colorless white crystalline powder, slightly soluble in water, and the molecular formula is C41, H64 and O14. It is a digitalis preparation were used for the cardiac glycosides, and as well as it is obtained from the leaves of plant Digitalis lanata. So the mechanism of action, it inhibits the sodium potassium adenosine triphosphate, that is ATP, and makes more calcium available for the contractive proteins, which increases the cardiac output by increasing the force of contraction. Whereas indication congestive heart failure, cardiogenic shock, arterial flutter, and the contraindications hypersensitivity, ventricular tachycardia, renal diseases, AV block, pregnancy, lactation, hypokalemia, and respiratory distress. And the side effects: blurred vision, diplopia, color vision defect, green yellow holes, headache, drowsiness, confusion, fatigue, depression, disorientation, vomiting, nausea, anorexia, hypotension, diarrhea, and as well as the lastly abdominal pain. So the pharmacokinetic of digoxin is orally onset of action will be in the 30 minutes to 2 hours with the peak concentration, and 6-hour duration for the action of 3 to 4 days, plasma half-life 35 to 36 hours, and excreted in urine which crosses the placental barrier, and the drug interaction may be cause hypokalemia, diuretics, corticosteroids, carbapenem, amphotericin B, increases the bradycardia with beta adrenergic blockers, and antidysrhythmics, where the uses for digoxin will be increases inotropic to improve the cardiac output in the congestive heart failure, decreases the AV node conduction, and in atrial fibrillation to slow down the ventricular rate, and class 1 indication HR control in atrial fibrillation plus congestive heart failure, and lastly the narrow therapeutic index, which will be 0.5 to 0.9 mg per ml. So the fifth question for the 10 marks: describe the method of bioassay and explain the bioassay of oxytocin. So the method for the bioassay are graded response bioassay, in that the sub-partition are bracketing, interpolation, matching, multi-point assay. With the second, that is quantal bioassay, in that the sub-partitions will be insulin, oxytocin, vasopressin, ACTH, gonotropic, D-tuberculin, and lastly digitalis. So the bioassay for oxytocin will be the principle to determine the power of the oxytocin is comparing its action, so that the standard preparation of oxytocin under the states of appropriate methods for the test. So you have to prepare the standard preparation and as well as the test sample. So the method A will be performed for the oxytocin will be by depression of the blood pressure in the chicken. Method B by contraction of a rat uterus. Method C by the measurement of milk ejection pressure in the lactating rat. So there are three methods which I have described here. You can easily copy. So the next question: write the mechanism and pharmacological action of prostaglandins. So the mechanism of action for the prostaglandins is the group of compound which is derived from the unsaturated 20 carbons of fatty acids, which is primarily arachidonic acid via the cyclooxygenase pathway. So there are extremely potent mediators of a diverse group for the physiological process, and it acts on his receptors and shows the effect. So the pharmacological actions for the prostaglandins is cardiovascular system, uterus, GIT, that is gastrointestinal tract, reproductive system, platelets, bronchial muscle, kidney, ANS depending on prostaglandins, and peripheral nerves. Then eye, metabolism, etc. So these are the pharmacological actions for prostaglandins. And what are the side effects or the adverse reaction for the prostaglandins? So the side effects or the adverse reaction for the prostaglandins are common in the use of prostaglandins, but there are the intensity which varies with the prostaglandins and the dose of the route, where these nausea, vomiting, watery diarrhea, uterine cramps, unduly forceful uterine and contraction, vaginal bleeding, flushing, shivering, fever, and fall in the BP, tachycardia, and lastly the chest pain. These are the adverse reaction or the side effects for the prostaglandins. So lastly, the question number 7, classify antihypertensive drugs with example. Describe the pharmacology of nifedipine. So the antihypertensive drugs are those drugs which are used in the treatment for the hypertension, act by reducing the cardiac output. So hypertension is a silent killer, where the hypertension disease is characterized by the abnormal high blood pressure, where the normal blood pressure in the normal adult will be 120 by 80 mmHg. So there are two types, that is primary or essential hypertension, and number second, that is secondary hypertension, where the primary or essential hypertension is the hypertension where exact cause will be not known, where the secondary hypertension may be due to the renal, endocrine or vascular disease. Hypertension is harmful irrespective of cause, and it may lead to the degenerative changes in the retinal tissue and as well as coronary renal tissue. So the classification for hypertension or the classification for antihypertensive drugs. So number 1, angiotensin conversion enzyme inhibitors, whereas ramipril, captopril, enalapril are the drugs which involves in the angiotensin conversion enzyme inhibitors. So number 2, that is calcium channel blockers, nifedipine, amlodipine, felodipine are the examples of the drugs, and angiotensin, that is AT1 receptor blockers, whereas lasostren, potassium and cardinostren, valstren are the examples for the drugs, and the beta adrenergic propiles, that is propranolol, atenolol, labetalol, cardiol are the examples of the drugs, and alpha adrenergic blockers, that is parazosin, terazosin, boxazocin and phenoxybenzamine. Vasodilators, atriolars, hydrazalin, minoxidil and dioxide are the drugs, whereas central sympatholytics, clonidine and methyl dopa, where lastly the diuretics, hydrochlorothiazide, furosemide, butanamide and spironolactone, where the pharmacology of nifedipine, it is a vasodilator which having a rapid onset of action with short duration of action. It causes dilation with the coronary blood and vessels due to the causes increase in the coronary blood flow. So it causes fall in the systolic and as well as diastolic in the BP and causes reflexes tachycardia, whereas the mechanism of action for the nifedipine, it decreases the arterial smooth muscles contractility, whereas the subsequent channels calcium ions entering to the cells through these channels, which binds to the clomedion. And a second proposed mechanism for the drugs, whereas vasodilatory effects, which involve the pH dependent inhibition of calcium influx via inhibition of smooth muscles carbonic anhydrase. And indication, that is hypertension, congestive heart failure, vasopatic angina, acute myocardial infraction, and lastly migraine. And the adverse reaction for nifedipine, the headache, fatigue, drowsiness, anxiety, depression, weakness, insomnia, nervousness, blurred vision, edema, vomiting, nausea, dry mouth, gastric upset, polyuria, skin rash, hair loss, sexual weakness, cough, fever, tachycardia, and lastly nasal stiffness. So the pharmacokinetic for the nifedipine, it is well absorbed orally, and the onset of action will be 20 minutes, and the peak concentration 1 to 6 hours. The serum half life will be 2 to 5 hours, and its protein binding will be 90 to 98%, where its hepatic metabolism will be cytochrome P450 system. It is extensively metabolized to the highly water soluble and inactive metabolites by accounting for 60 to 80% of dose excreted in urine. So the drug interaction will be cimetidine, which increases the nifedipine level, decreases the effect of the nifedipine, and with the quinidine synergism with beta blocker. And the clinical uses for nifedipine, it is used in the treatment of hypertension and as well as chronic stable angina. The dose will be for adult 2 to 20 mg 3 times a day, or the maximum dose will be 120 mg per day, with a contraindication hypersensitivity, hypotension, pregnancy, lactation, and children, renal diseases, etc. So till here we have completed the 7 question and answers for the 10 marks of pharmacology 2nd 5th semester. Tomorrow I am going to give you the continuation of pharmacology from 8th question to 15th. So there will be the completion of 10 marks for the pharmacology 2nd. So please do like, share and subscribe to my channel.